Hi, everybody. Welcome to We Can't Do This Alone. I'm your host, Erin Stitzel. And today we're going to be talking about a partnership that is one of the most essential partnerships that you have to have in order to thrive in healthcare philanthropy. And that's partnership with your CEO. Today, we're bringing you one of the most compelling examples of this in our industry. Tampa General Hospital Health System has undergone a remarkable transformation over the past few years, both clinically, operationally, and philanthropically. So it's so great to have you guys on the show. I am so excited for our discussion today. First and foremost, let's share with the audience a little bit more about you guys. So John, why don't you go first? If you wouldn't mind sharing a little bit about you. How did you come to Tampa General? Tell us about that journey. Tell us about your role.
Well, thanks for the question, Erin. I've been at TGH for a little over 8 years. I was on the East Coast of Florida at Jupiter Medical for 7.5 years. And then prior to that, I was at the Baycare Health System in Clearwater. And then prior to that, where I got my start in healthcare, I was at the Mass General Brigham Health System in Boston. At the time, it was called Partners Healthcare, and I was specifically at Massachusetts General Hospital, but now it's known as MGB, and that's where I got my start. I spent a little over a decade there. I've always loved the academic medical center space and health system space. I love the relationship we have with our university, the University of South Florida. And so when I got the opportunity to come back to Tampa to lead TGH, I jumped at the opportunity, and it's been a wonderful 8 years.
I love that. Well, and I have to jump in really quick, John. I'm in Columbus, Ohio, and speaking of University of South Florida, you guys just stole our football coach. So
Yeah, we did.
you're new with Mr. Hartline. So I had to sneak that, and we're very, very sad he's leaving, and we have no doubt your football program is going to thrive under him. So, all right, Frann, how about you?
Yeah, so I joined Tampa General just a little over 7 years ago, and my background was a little bit different. I didn't start out in healthcare. I actually started out in private industry in the telecom business, and I did that for 16 years, and then made the transition into nonprofit fundraising in the academic setting. So when I had the opportunity to move over, actually I was at USF Health, so I had experience, a little bit with the medical side, but not on the hospital or healthcare side, and was able to move over to TGH and be a partner with John and the executive team here. And I felt like it was, the same family, maybe a little bit across the street over at TGH.
Absolutely. Absolutely. Well, and John, I want to talk about your vision for TGH and just to share with the audience. So I actually started working with TGH in 2019 as a consultant with your philanthropy program, helping you start a Grateful Patient program. And so, it was September 2019, and it's been incredible to watch just what has happened with the health system. It was incredible to be a part of it for a couple of years. But John, this, regardless of philanthropy, it really, really starts with your vision. And so can you share your vision? Again, I'm going to keep saying that journey, but, what has been your vision? What is your vision for TGH?
Well,
Tell us
yeah,
about that.
no, I appreciate the question, Erin. I mean, our vision, simply stated, is to be the safest and most innovative academic health system in the country. And we've been on that journey for the last 8 years. Now, we measure that, actually. So we're part of a cohort of academic health systems, roughly 115 of them. They're part of an organization called Vizient. And so I want you to think about health systems like UCLA Medical Center, Stanford Medical Center up in San Francisco and Palo Alto, think Vanderbilt, Mass General, Brigham, et cetera. We're part of that cohort, right? And so we measure ourselves against some of the best in the business in the academic health system space. Today, actually, we just got some results in late last week. We're in the top decile in overall quality. We're in the top decile in safety, and we're in the top decile in mortality. You kind of come into the hospital alive and you leave alive. And we're very proud of that. And so when we talk about being the safest and most innovative academic health system in the country, we measure ourselves against who we consider to be some of the best academic health systems in the United States. And most of those hospitals aren't just in the Vizient cohort, but they're oftentimes on the top 20 honor roll for US News and World Report, which is where we're, moving towards. And so we're very excited about the work that we've been doing. The vision is very clear. It's very concise. And we are in the middle of implementing that. But that's the journey, simply put.
Well, and John, you brought Frann on in 2018. Why did you make the decision to hire Frann? And talk about what it's been like working with her.
Well, just for for contextual purposes.
Yes.
When I got here and we set the new vision that you just asked about, we realized that we needed to retool the foundation that Frann currently leads. Because in our industry, there's 3 ways to invest in your vision. You can earn the money, you can borrow the money, or you can raise the money. So philanthropy is incredibly important and it's incredibly strategic. So we did a national search. We found Frann, thankfully. Frann has done an absolutely outstanding job. What attracted me to Frann initially were really her value set. It wasn't her ability to raise money. I knew she was an effective fundraiser. I knew she understood philanthropy. What I was most enamored with was her cultural alignment with the health system and with me specifically. Frann is very authentic. She's, what you see is what you get. Frann is kind-hearted and she uses love and empathy to lead people. Frann is transparent. Her leadership style is very transparent. She explains the why behind what she does. She's very open with the organization, and she really attracts people because of that transparency. And that's hard to do for some people. And finally, Frann shows real vulnerability. So Frann is willing to admit when she makes a mistake. She's willing to ask for help. She's willing to apologize for things that might not be going the way we want them to go if they require an apology. Most don't, because, look, we're in a very complicated business, but her value set is outstanding. It aligns with mine and it aligns with the organization. So when I met her, well, clearly she knows how to raise money. Clearly she knew how to run a fundraising organization. Even though this was Frann's first president role, she really understood fundraising, but it was her values that I really got attracted to. Because I think at the end of the day, that's what matters most. That's kind of what gives people like Frann and the organization staying power.
Mm-hmm.
And that's what I think organizations have to spend a lot of time focused on, is their cultural alignment and fit. Frann fit us perfectly. And candidly, and Frann's going to talk about it, if you look at her results and her team's results, they speak for themselves.
Mm-hmm.
And I think a lot of it has to do with the cultural alignment work that we spend a lot of time on.
I love that so much. I mean, so many times, for example, say, when you're hiring a nurse, look at their bedside manner, anyone can kind of place an IV, but you can't teach somebody values and compassion and that empathy and that sort of thing. And so I love that so much. Frann, on the flip side, talk about John's leadership. What's it been like working with him? What does that look like?
Yeah, happy to do that. So it's funny because everything that John just explained about the why for him choosing me, my why is almost identical. I mean, I think I knew almost instantly, obviously John was one of the first folks that I had the opportunity to meet during the interview process. And I just instantly, liked him, felt safe with him, knew that the things that he was saying were authentic. We use that word a lot because it's so important. And the pace at which he worked was also extremely attractive to me because spending so much of my career in private industry and then moving into academics, I felt like it was a grind. I felt like it was slow, and I felt like it probably wasn't the best fit for my personality. So when I met John and just felt the energy and talked to him a lot about the culture and what it would be like at Tampa General, I just knew really almost instantly that was going to be the right fit for me and my personality.
Well, Frann, I'll never forget the first time I met you. And I've said this about you so many times, why you're one of the best in our industry. You make decisions fast. And that's so key. I mean, as we know, healthcare, it can take, things can get held up, but that doesn't happen with you. And I love that. That takes a lot of courage. You've got to know what you're doing. You've got to be able to think on your feet, and you're not afraid to make a decision quickly. And that's so key. So, well, and let's talk about, we talked a little bit about, we'll talk about philanthropic success. What did it look like when you started at Tampa General? What kind of shape is the foundation in? What did that look like, and what does it look like today?
Yeah. So just like the title of the podcast, right? We can't do this alone.
Yeah.
So I feel like prior to John's arrival, that all of my predecessors really didn't have, the understanding and the support probably from the executive leadership that they really needed to be successful in a true, impactful, transformative way. So they did great, I think, with what they had. They were very consistent. They always had wonderful leadership. They had a great board. They did a lot of fundraising through events, and they had wildly successful events. It was the talk of the town for years. Everybody loved to be a part of it. So, that was sort of our base, right? And I inherited a team of 5, and it was very tiny and a lot of growth that we obviously had to implement. But I feel like the basics were there, and certainly having the board that we had that believed in John's vision and the entire executive leadership team and really heard with John's sponsorship all the way through what was possible for a foundation. And they were hearing it, I think, for the first time, probably from the leaders at Tampa General, and that got them excited, and they rallied around it and gave us the tools that we needed to grow and succeed.
How did you begin to start building those relationships with the executive team? How did you start to begin to kind of change that conversation a little bit?
Yeah, so it was a lot of talking about what could be, probably 90% listening, I would say, the first 2 years, really just getting to know my colleagues, understanding what was important to them. I knew coming into this that we had to be aligned completely with everything that was happening throughout the healthcare system. And I knew that our branding and everything that we did had to be lockstep with the vision. And so just a lot of time understanding everybody's role, asking questions about how we could potentially help them, asking what their experience was with the philanthropy, in their past lives, in their current lives, et cetera. And just really starting that way, but then finding those prove-its, right? I think sometimes when you say things, unless you're actually doing them in the background, people don't believe you. So it's been a lot of really just grit, hard work, right? Building those partnerships, proving the theory, showing in action that we are capable of making a difference for everybody's life here at TGH, I guess.
Absolutely.
Yeah.
Well, and speaking of action, John, so, you're CEO, extremely busy, I say it's sometimes it can be easy to kind of say you're in support of philanthropy, but speaking of action, really walking the walk, not just talking the talk, is something that you do. And not everybody has a CEO like you. From your point of view, what does that commitment look like as CEO? How do you show that you're walking the walk, and how do you kind of spread that throughout the other executive leadership team? What does that look like?
Let me answer it. It's a great question, Erin. Let me answer it functionally/structurally.
Sure.
Let me quickly answer it more strategically or more philosophically. So if you just think structurally and functionally, Frann has a board of directors, but Frann directly reports to me. And she has a board that governs the 501c3, that's our foundation, but it's a wholly owned subsidiary of Tampa General. So functionally and structurally, she's part of the senior leadership team, or actually, let me rephrase it. She's part of the executive team. So
Yes.
she's part of the CEO cabinet. That wasn't always the case, right? So you've got to make sure, I mean, the foundation leader always reported to the CEO, but the foundation leader wasn't always part of the executive committee of the CEO, or what I call the CEO cabinet. She's an important member of that cabinet. She's a direct report of mine. And that's really important because some health systems, they don't have that alignment. You've got to have, in opinion, you have to have that alignment because
I work all over the country. There are some philanthropy leaders who don't report to the CEO who would love that to be different.
Yeah, it's a problem because people have to remember that the foundation is designed to support the interests and the strategies of the health system. So that functional and structural alignment is critically important. It allows you actually to move faster, to be more efficient. It drives innovation more efficiently in the organization between the health system and the foundation. It's very, very important. Okay. Philosophically, I look at the foundation as strategic. It's an enabler. So the foundation doesn't have like its own strategies related to the delivery of healthcare. It's an enabler to the system to allow the system to deliver healthcare in a more efficient and effective way. And that strategic partnership is critically important. We're able to do things more effectively in a lot of cases because we have the support of the foundation. A great example of this, just to crystallize what I mean, is if we go back in time to COVID, we set up a team member emergency fund for team members that were struggling financially. Because what was happening back then is even though the TGH system, we weren't laying people off, we weren't furloughing people, there were a lot of our team members that had spouses, partners that had a job that no longer have a job. And they went from a 2 household income to a 1 household income. And they came to us and said, we're panicked. We live paycheck to paycheck. We have a family. We don't know what to do. We're struggling to think about how we're going to pay our mortgage this month. Can we get some help? And so we set up a team member emergency fund. Let me back up. We took an existing team member emergency fund, kind of retooled it a little bit to deal with these COVID challenges and provided funding through a grant process to team members for mortgages, car payments, phone bills, electric bills, school supplies because of remote learning.
Yep.
Foundation funded that for us because I went to Frann and said, Frann, here's the challenge. Here's what we need to do. Here's the why behind what we need to do. Let's go raise money to support our team. And Frann and her team raised millions of dollars to support that team member emergency fund so we could support our team. That's a great example of complete alignment using the foundation as a strategic differentiator and providing the needed support to our team members. Like that's a great, and I've got dozens of those examples I could share with you. We don't have time today, but that's a good example of how we work strategically with the foundation. So you've got to think of it both structurally and functionally and make sure there's complete alignment around that. And then you've got to see the team as strategic. And when you put the two of those together, really cool things happen and you start to make a real difference in a sustainable, reliable way, which has been wonderful for us.
And Erin, if I could add to that,
Please do.
One thing that I think makes John and I's relationship very unique is that it's not just the things that we do together, but it's also the things we say no to. Because John, you'll remember there's been a couple of instances where we've had a donor who's offered millions of dollars for gifts, but they wanted, X done or something done in return. And John and I very linked, right? Very arm in arm said, no, either it's not a priority, it's not something that aligns with our values, it's just not something we're going to do. And those conversations are hard to have, right? But they're important.
And it's a great point, Fran, is look, the foundation is driven on fundraising. So they want to raise as much money as possible. They're organized around that. And Fran, as you said in your opening remarks, Erin does it better than most,
Yes,
and
she does.
has increased our fundraising exponentially.
Yes.
But the foundation doesn't set strategy. The health system sets strategy, and the foundation helps to deliver on that strategy. So when a donor comes and says, well, I want to give you $10 million and I want you to build this program, if it doesn't fit with our strategy and our vision, we say no. And Fran's right. It's sometimes really hard to say no.
Yeah, it's hard to pass up money, but.
Well, right. But because Fran and I and our teams are so aligned, it makes it easier, and it's incredibly important. It's incredibly important to have that kind of relationship with your foundation president.
John, I feel like you could be on like a healthcare philanthropy billboard with some of the things that you just said. I can't, I mean, truly, there's so much truth in that. Like, you could do my job for me. So just come alongside, or we're gonna share clips of this throughout many presentations, right, Frann?
Yeah. Any way you want.
What you just said hits the, I don't even know what, the nail on the coffin. I'm bad at analogies, but
yeah.
But you know what, Erin, it goes back to culture. The reason I emphasize culture a lot. I work on our health system's culture every day. Fran can attest to that. It goes back to cultural alignment. The reason, and Fran and I don't always agree on everything. And there are oftentimes behind closed doors, there's a negotiation. There are vigorous discussions and that's healthy and that's important. But at its core, we're culturally aligned. We believe in the same things. We have the same values. She understands the mission. She understands the importance of the foundation supporting the health system and not the other way around. But it all goes back to culture, because that really helps, because it's very natural for Fran and I. I mean, it's not because we're doing this podcast with you. I absolutely adore Fran and her team. They're excellent people at their core. They've got great values. And to me, as a leader, that is the single most important thing. Because if you have complete alignment, if you have complete alignment culturally, there really isn't anything you can't tackle together.
True.
I love that.
Yeah.
I love that. Well, and Fran, your team has had such little turnover, which is very abnormal in our industry. I mean, you guys get awards all the time about being best place to work. I watch you guys all the time from Columbus. I joke. I mean, literally, I'm like, I would come down there for care from Ohio. You guys are doing everything right. So it's so exciting to hear you guys talk about it. Let's talk about success here a little bit. Talking about results. Sorry. The extraordinary philanthropy results, Fran, you know the numbers better than me. If you can share just some of the things that have happened from when you got to TGH, what does that look like? I know you've quickly met philanthropy goals. You're in campaign. You're raising more money than patients than most organizations out there. And I know that because I'm a grateful patient consultant and you are the best. So talk about that if you wouldn't mind.
Yeah. Well, obviously, first and foremost, it comes down to team, right? We just have a great team, like John said, just really wonderful group of men and women that do this work, down to their core, right? But a lot of our success, so it's interesting because prior to John's arrival and my arrival, the foundation had done a couple of very small targeted campaigns, but never in the history of Tampa General have they done a fully comprehensive campaign. So Erin, you'll remember this, but when we brought you all in to do some case studies for us, I will never forget the recommendation came back that if you guys are going to do this for the first time, I keep hearing from John and from the board that you want the goal to be 100 million, but that's a long way. Like, that's a very deep request. And, maybe you can get there, maybe you can't, but that's what we're going to recommend, because if anyone can do it, it's Tampa General. So we set off down that road thinking it would take us every bit of 5 years to get there. And after less than 2 years, we had surpassed that goal. And it's really a testament to the work that's done here, the care that's provided, and how really interested the community was to rally around it. They love what they're seeing. They want to support it, right? In a big way. So we raised the goal to 200 million over 6 years, and we have about a year and a half left. And we're currently sitting just under that 200 million mark now. So we know that we'll surpass that goal. We're not sure, what the next milestone will be, but it's just a really great representation of the community, the belief that they have, and the care that we provide, and just all of the wonderful talent that we're able to support.
Any examples of, can you think of, working together, the two of you, to close a gift or a project, or anything come to mind, a story or something that stands out as particularly fun or exciting?
Why don't you pick?
I think of Muma, John. I think of Muma. So the Muma, Pam and Les Muma are very well-known philanthropists in our community, and they're very active. Pam was on the foundation board, Les on the hospital board, so very active with us. But when I was first starting the work here, I went and had lunch with them, and they told me flat out, we are done making major gifts. There will be no more major gifts. This is it. So over a period of 5 years, their love is really with kiddos, with the Children's Hospital. And they had done something for the NICU that was truly transformational prior to my arrival. And so it was really one of the best stories that I can tell over a 5-year period. And this would take the entire hour to go over every detail. But it was things like John taking them up to show them a renovation of one of our ICUs, because their kind of argument to supporting the Children's Hospital was that we're a 100-year-old building, low ceilings, it's going to be putting lipstick on a pig. John, you have to help me remember. I think that's what Pam said, lipstick on a pig.
Right. No, you're right.
Yeah. So it was him being willing to give them a personal tour of that space, saying, look, this is the same building, right? This is what this can look like with this reno that we so desperately need for our Children's Hospital. And we have this great concept of a hospital within a hospital. And anyway, it was just years and years of that type of activity of multiple people. Our service line leader, Melissa Golenbeck, who's now our chief operating officer, is fabulous. She's an incredible partner to all of her colleagues, but really very much so to the foundation. And I think just really a lot of work behind the scenes throughout that 5-year period of different touches that ultimately led to a transformational gift in the naming of our Children's Hospital.
Yeah, I think just to add on to that, Erin, a couple things for people who are listening to think about. Number one, the fact that Frann and her team understand our strategies and the vision, and they don't just understand it like superficially. I spend time with them on an annual basis, or more than annual. I spend time with them several times a year with Frann and her. Well, Frann's involved every day with me, but her team, and we spend time talking about the strategy and the why behind the strategy. So her foundation team understands the strategy. Now, they may not understand all the nuances of the strategy,
Sure,
but they understand the big, broad brushstrokes of the strategy. That's really important for people to understand. You need, your fundraisers need to understand the product they're selling in a really big way. And you can't, not superficially. Her team is very eager. Her team is very smart, and her team is very accomplished, right? So that's part of it, right? That understanding strategically where we're going, almost like in a 3-dimensional kind of a way. They can naturally and comfortably articulate what we're doing and why we're doing what we're doing. Number two, we don't oversell any project to get a donation. So to Frann's point, I brought the boomers to this particular floor and said, look, you're sitting in our original hospital that's 100 years old. I understand you're struggling with how we're going to remodel a 100-year-old hospital or several floors on a 100-year-old hospital. Let me show you what we've recently done in this building so you can understand what we're capable of, right? Like so come on and take a look at that, right? And understand what we can do, but then also not overdo it. Like this is what we can do. This is what we can't do. This is what you can expect. I'll give you just to go a little bit further on it. Early on when we were working with Pam and Les, they wanted a freestanding children's hospital. And I said, we will not be building a we will not be building a freestanding children's hospital. We will be building a hospital within a hospital, but we're not going to build a freestanding children's hospital. And Pam and Les, who are two very smart, thoughtful people, said, well, why? I said, easy. The economics of pediatric care doesn't support building
Sure.
a de novo freestanding children's hospital. It just economically doesn't work. And we spent a little bit of time on that. And Les being part of the board of the parent company, Florida Health Sciences Center, which I'm the CEO of, understood it. Pam being very smart, wanted to understand it a little bit. So we spent time being transparent. And I talked about transparency earlier in the podcast. We were very transparent. We didn't tell them something we thought they wanted to hear. We told them reality. This is what we can do. This is what we can't do. But most importantly, I said, Pam and Les, we are going to change the way we care for children in this community that have high acuity illnesses and disease, because we're really a health system designed around taking care of the most rare and complex cases. And that goes not just for the adult side of our health system, but also the pediatric side of our health system. And they're typically the most vulnerable in our community. These are kids that have families that may not be able to afford the kind of care that we're giving them. But because we're a safety net hospital and health system, we're here for everyone, regardless of their ability to pay, right? We believe fundamentally that it should be a right to access world-class healthcare, not a privilege. So I said, let's think about what we're functionally going to be doing for these children in the current envelope. That kind of openness and that kind of ability to sync between the foundation and the health system, critically important. And really savvy donors can feel that. They can see that. Are we aligned or aren't we? And they are two of the most savvy donors you'll ever meet.
Yeah.
They're wonderful philanthropists and they're incredibly generous, but they're also really, really smart around this. And so being open, being transparent, explaining what you can do, but also what you can't do, incredibly important.
Let's put it on a billboard again, John Couris.
Yeah.
Let's put it on a billboard. Absolutely. No, I so appreciate that. Well, and so as we wrap up a little bit, I want to go back to, again, this great working relationship between the two of you. I know it didn't happen overnight, but truly, I mean, your partnership has enabled so much success to have been achieved. So, and, obviously this podcast is called We Can't Do This Alone, to hopefully help folks build a partnership like you have built. So couple questions for both of you. So John, quick question. If someone like Frann, the executive vice president of philanthropy, someone in her role, if they've got 10 minutes on your calendar, what should they be focusing on? What should they be prepared to do? Because obviously your time is very limited. If you've got a short window, what should that person do?
It's a great question. First of all, Frann can get onto my schedule anytime Frann wants. It's usually never for 10 minutes. It's usually longer.
Yeah.
But if she just had to jump on my schedule and what do I want to know? I like to talk strategy and philosophy with my executives. I don't need to know what they're doing day to day. Like, because it's interesting just for contextual purposes. I have about 14 direct reports, and someone said, depending on your perspective, that's a lot. That's okay. That's not it like depends, but it's a lot of direct reports. Someone said, boy, that's 14's a lot. I said, well, it really isn't, because I don't have to manage one of them. I lead them. I don't manage them. If you're a CEO and you actually have to manage your executives, then that's a problem on many levels. And you can't have 14 people reporting to you, because I don't have, and so it makes it easy for me. I don't manage Frann. I don't worry about what Frann's doing day to day, moment to moment, or tactically, because she's an absolute expert in her space. My job is to lead Frann, right? To provide her direction, mentorship, but that takes the form of sitting in my office and talking strategy, talking philosophy, talking big picture stuff. Now, if Frann needs to come to me with a tactical question about something, she can anytime she wants. But I do best when someone comes into my office and says, I need 10 minutes and I want to talk about some strategies. I need a little bit of direction and some leadership around this. Help me. Great. If Frann came in for 10 minutes and said, I want to talk to you about HR issues, I would say, okay, but that's what people and talent are for. Spend time with people and talent. What's nice about my relationship with Frann is she gets it. So I don't manage her. I lead her. I'm her partner. I'm her collaborator. We're doing this together, but it's all about strategy and philosophy coming into my office.
What do you think, what builds trust fastest with you as a senior leader?
Mean what you say and say what you mean.
Okay. Love that.
That is it.
Okay.
And
That's it. That's easy.
And be consistent about it.
Yep.
Like, and it goes back to sort of authenticity. Don't ever try to be a version of yourself that you think I want you to be. Just be yourself. Idiosyncrasies at all. We all have them, right? Every one of us is imperfect by design. Every one of us is working on something to be a better leader, a better person, etc. We're all striving to be the best versions of ourselves. Don't pretend you're somebody that you're not. I give every one of my executives at Frann's level a coach, a professional coach.
I love that.
They work with the executive, they work with me and the executive, and it's been absolutely wonderful. I mean, it's been absolutely wonderful, but it all boils down to being comfortable with who you are, working on the things you need to work on, and mean what you say and say what you mean.
Absolutely.
That's it.
Okay. That's it. Frann, I think John might have answered this, but how do you decide what rises to John's level versus what you need to keep within your team?
Yeah, it's a great question. So it varies, right? But it's funny. I think a lot of us are collaborative by nature. So I spend a lot of time with my leadership in collaboration. And I think I was a little dense. I think my first couple of years, John, and you'll probably laugh at me for this, but I think I would go to John's office wanting to collaborate maybe and talk through some things. And at this level, I really should have been much more prepared strategically to bring to John, look, this is what we're thinking. I have one or two ideas, lean into one of these for me. Does one of these feel better for you than another one, kind of a thing, versus getting him a little bit earlier on in those conversations. And so that was kind of a hard lesson learned, because I felt like I was aggravating him. And even though he would never show that, I felt that way. And so, hard lesson learned, right? But strengthened the relationship, I think, because then I felt like I could really, truly be myself and take the hits where they were deserved and tweak it and make it better and really be a lot more prepared for bringing things to him.
It's interesting because Frann brought up aggravating me. So she never aggravated me. But here's something that's really important, and it goes back to our culture. She came to me and said, this is how I feel. I feel like I'm putting you out and I'm aggravating you because I'm bringing you some minutia that I'm not sure you want. So I got because we work in a psychologically safe environment, she could come to me and express herself honestly and openly. And I was able to then address it and say, no, friend, actually, you're not aggravating me, but I do think you bring me things that an executive at your level shouldn't be bringing me. I'm the CEO of a system. I don't want to get into the management of your division. That's what I don't want to do, only because I don't know what you know. And I don't want to get in your way. Now, if you want to talk to me about strategy and philosophy and how I might deal with an issue, absolutely. But if Frann didn't feel comfortable coming to me saying, I feel like, to use Frann's word, I'm aggravating you, we never would have the open conversation around better ways to connect with each other strategically and philosophically. It goes back to culture. It goes back to the CEOs that might be listening to this. Ask yourself this question. Do you really create a psychologically safe environment where people can come to you and be who they really are and ask that question? I've had the good fortune, of working for some really great CEOs, but I can only think of maybe one that I felt psychologically safe with, that I could walk into their office and say, I feel like I'm aggravating you and I'm struggling with that. Would you help me with that, please? I can't, and I've worked for some really good people. I can't, I can't even the one that I'm thinking of, I might personally struggle with that. Now that's not on them. That's on me and the culture that I worked in, right? If that makes sense.
Oh, yeah.
Like it just, and I know when I was coming up in the industry, I didn't like that. Like I like being who I am, idiosyncrasies and all. We work really hard in this organization to not judge people. So if you're going to come to us or to me and you're going to be who you really are, and you're going to ask the question like Frann asked, like, am I aggravating you? I'm not judging her for that. I'm like, no, Frann, that's ridiculous. But you know what? Here's what you could be doing differently. Now, by the way, no, Frann, it's ridiculous. Her feeling isn't ridiculous. Her feelings are legitimate. And you, as a leader, you have to legitimize the feeling. That's how she felt. So that was very real to her. But then you get an opportunity to work through it and to say, no, that's your feeling's not ridiculous, but the idea that I'm aggravated is ridiculous. No, it gave me the opportunity to sit with Frann and say, as an executive vice president and president of our foundation, this is the level you need to be working at. And these are the things you need to be thinking about. I mean, I'm here for everything you need, including some of the detail, but 99% of the time, you got to be thinking big picture, big strategy, big thematic work. That's how we do it. But again, it starts with the relationship and it starts with the culture. And like I said a moment ago, I'd ask the CEOs that are listening to this, do you really create an environment where people feel psychologically safe to come to you and express themselves the way they really feel? Frann has no problem doing that. She does that.
You said at the beginning, I mean, Frann,
well.
You created that safe environment, but Frann is also vulnerable. Kudos to you, Frann,
Right.
for asking you that, because I could think of a million folks that would not be brave enough or willing to be vulnerable or put themselves in the position to share that and get that feedback. So
Yeah.
The job of the CEO is to create the door, and then the direct report, in this case, Frann, needs to walk through the door. Frann's great at that. But Frann is incredibly sophisticated, clear in her thought, an outstanding human being. She really is. I mean,
yes.
she brings a lot of that with her, which is important. Again, it goes back to culture. We knew Frann could technically do the job. We knew that it was a big step up because it was her first president role, but it was the cultural fit that got us really excited about Frann. And it's paying off huge.
Absolutely.
Thank you.
Okay. Well, again, this podcast is called We Can't Do This Alone. We cannot do healthcare philanthropy without our CEO. So, John, you kind of already alluded to this, but speaking to other CEOs out there, what is your one piece of advice for a CEO? Maybe somebody who doesn't think they have time for philanthropy or is nervous, or maybe they don't know, or just really what's your one best piece of advice for CEOs out there, aside from what you've already said, which has all been absolutely incredible advice? But what's that one thing that you might want to leave the listener with?
Well, it's a good question. I'd also I know you probably asked Frann a similar question because
I'll ask her that in a second. So.
Yeah, good. Because I'm interested in her answer
Yeah,
too.
she's going to get her chance next.
Yeah, no pressure. Yeah, no pressure. But well, if you're a CEO, you need to understand that your philanthropic leader is your friend. It's not like an extra thing to do. They're critically important to the success of your organization. They're strategic. And if you use the team correctly, they can be a strategic differentiator for you. Frann has shown how she could be a strategic differentiator for the health system overall. And she's done that really well. That's number one. Number two, you as a leader, as the CEO of the system, need to create an environment where people like Frann can be the best versions of themselves. You want to create safe places and spaces for them to come to you. So Frann, in her example a moment ago, can come to the CEO and say, I'm feeling a little disconnected. I'm feeling like I'm frustrating you. Can we talk about that? That's the job of the CEO, to create the environment for someone like Frann to come in and say, I feel safe. I know I can approach my CEO with this and I'm not going to be judged for it. Now, that's because Frann, like you said a moment ago, Erin, owns a lot of that, meaning in a really good way. She's done an excellent job with that, but it's the CEO's job to create the conditions on the ground to allow Frann to be the very best version of herself. You have to ask yourself, am I providing an environment, in this case for my executive in charge of philanthropy, to be the best versions of themselves? I believe I'm doing that for Frann. And listen, this isn't Shangri-La. Everything we do isn't perfect. Every conversation we have isn't exactly the way we want it to be, but we have a really healthy environment where we can talk through the issues and we're not fearful that either one of us is going to get judged for it, right? So that's the job of the CEO, to create those conditions for high performing executives like Frann. So I would think in terms like that when you think about how you want to interact with your executive over philanthropy.
Okay. Frann, what is your one piece of advice for healthcare philanthropy leaders all over the country when it comes to building, maintaining, executing a fantastic partnership with your CEO, one of your most important allies?
Yes, I don't want to be remiss to the fact that I do realize how very lucky and very spoiled that I am, because John is not only a shrewd, dynamic, brilliant leader, but he's got a big heart. And you've just heard examples of that throughout this entire conversation. He is just genuinely one of the most wonderful human beings I've ever had the pleasure of working with. And not everybody gets that, and I do understand that. So what I would recommend to my colleagues across the country is simply this. I call it reverse gratitude, which probably is not the best way to explain it. But I spend a lot of time thanking and showing gratitude towards my colleagues, to the executive team, to my board members, certainly to our physician partners and all of our clinical teams, all of our team members, just a lot of time saying we are successful doing what we do because of all of you. And I think sometimes as philanthropy leaders, we get lost in that, or we may miss opportunities to do that. And I just think that's key to all of our success.
Well said.
So well said. Okay, so that wraps up our episode. I'm going to, in the words of my husband, who always says, we're in the presence of greatness. Everybody to our audience, truly You two are the best. I don't even have anything else to say. Everything was said on this episode. John and Frann, thank you so much for spending an hour with us today. I cannot thank you enough for everything you shared, your experiences, and for your leadership and everything that you're doing. It's all inspiring. It's been incredible to watch. And again, just thank you from the bottom of my heart. So that wraps up our episode. Thank you so much for being with us. And we can't wait to see you for the next episode. Thank you.
Thank you very
Erin,
much.